Hello and thank you for joining us. You can now pre-order your flu and COVID vaccines, but the province still has not decided how much it will cost most Albertans to get their COVID shot. A fee is being added because the government wants to cut down on waste. But health experts say this could create a medical backlog in hospitals because of healthcare inequity. Tyson Fedor explains.
Ryan Penyuk suffers with long COVID, and he says a COVID vaccine is now part of his life every year.
Just doing laundry in my house, I just noticed going up and down the stairs a lot. It's giving me complete exhaustion to the point where I just felt so sore. My muscles were all sore. I'd have to sit down.
On Monday, the province opened pre-order bookings for influenza and COVID-19 immunizations. Although free for those in senior care facilities and those with underlying health conditions, the remainder of Albertans will have to pay for a COVID shot.
Those who want it as sort of an extra measure of protection, they'll be able to pay the cost associated with that.
That price tag has not been finalized, but the province has previously used U.S. figures to estimate its loss at $110 per shot.
There was a lot of wastage, quite frankly. 54% of the product was going to waste. And that cost, we did a calculation, over $200 million over the last 3 years. We can't afford to be over-ordering on product that people aren't consuming.
I think, unfortunately, this is going to create a barrier where some people may not be able to get the vaccine if they want to.
More than 700,000 doses were administered last year. The province ordered less than 500,000 this year.
The only province or territory that's asking its citizens to pay for a vaccine which is safe and effective.
Alberta's former top doctor says the new rollout is creating barriers for those seeking an added layer of protection.
It's an incredibly bad policy. The province has made the vaccine less accessible. They've cut out 90% of the venues that it could be available at, which were the pharmacies.
As for Alberta's Federation of Labour, it advocates for public health care. Gil McGowan says healthcare and education workers are having to fork over money to pay for a shot when they are at risk every day.
Nowhere on the list are people who have increased likelihood of exposure due to their work. This is a recipe for a medical disaster.
And Tyson joins us from the South Calgary Health Centre tonight. Tyson, pre-ordering began today, so when can Albertans actually make a booking?
Well, Tara, the province does say it's important to know exactly how many vaccines are needed to minimize control and waste costs. Of course, those pre-bookings started today. You'll have until September the 30th if you would like to pre-book your influenza or COVID-19 vaccine shot. Now, if that deadline comes and goes, the province did say today that you will still be able to book an appointment after September 30th when that vaccine does become available. Tara?
Okay, Tyson, thank you.